question to you was around the latest figures that we have for today. What are they?
The latest numbers of positive patients is 2,173. And that's 145 new tests that have turned positive today. What I think is important is that we've done 8,000 tests. 5,000 of those tests done yesterday. In the past day, actually largely from the public sector. So this means that the outreach teams that are going out to test in the communities are beginning to increase the numbers of tests that we are doing. And so I would like to take you through the provincial totals. The Gauteng 865, Western Cape is 557, KwaZulu-Natal is 443, the Free State is 96, Eastern Cape is 88, Limpopo 23, Mpumalanga 21, Northwest it's 19, Northern Cape is 16, then for 15 we're still trying to allocate because of shortage of information. There are no deaths today, and the recoveries we will do at the end of the week because we match them up after 14 days. So this is where the numbers stand today. Thank you.
All right. Minister, we seem to be having a bit of difficulty with this line, but I'm going to try and make sure that we prevail through. One of the things that has been a big talking point is the projections that the state has been working on, especially those that were presented before the Health Committee to Parliament on Friday. Speak to us about where those projections are coming from and why September is seen as the month where the COVID-19 pandemic in the country will reach its peak.
Well, at the moment, what we're dealing with are kind of projections which are looking at various scenarios of what we need to do in preparation. So one of the things that we are looking at is that between now and the end of the lockdown, we should see some slight flattening of the curve due to the fact that there is less movement in large numbers, big meetings, and that in the process there's also the imported cases have actually been closed down, so we've actually stopped the immediate rise in the internal transmission. But once we undo the lockdown, we will be forced then to start looking at more people moving, and therefore the inspection will start rising again. But also with the flu season, the numbers are going to increase. What we are hoping to do is to actually continue the mechanisms to reduce spread of the infection so that over that period we should see the epidemic not rising as fast as it has been doing in many countries. 2 days ago we did show that there is already an indication that the curve is flattened a little bit. Still very early, therefore it's not time to celebrate. It's just to say that the lockdown is working, but we know that lockdown can't be forever, so we're building up our capacity to go out and find more of the people who are infected so that we can deal with the infection as soon as it is spotted in the community. It is different to the way that most of the countries have done, where they wait for the infections in hospitals, and then in our case we want to make sure that we are able to detect and treat early in those areas where we think they are hotspots. So that is what hope is going to drag the infection much longer so that we don't have an immediate peak. So it would allow us that those of us who are infected can be treated to recover before it overwhelms our entire health system.
And it's interesting that you're working off the premise then of post-lockdown South Africa. So by all indications, then it means that the extension that we're seeing, that there might not be a likelihood of having a further extension beyond this.
Well, I cannot say that there will be a further extension, but I want to suggest that it's important for us to understand that it's about the lives of South Africans, and therefore we'll look at the stats and look at what it actually shows us. and therefore we'll discuss what happens next. But we will make use of the 2 weeks extension that the President has given us to try and strengthen our teams, that will go out and ensure that there's screening, that there's testing, that we wrap up the testing to higher levels than has been happening now, that we also start opening up additional beds during the flu seasons so that people who have got infection can be triaged and separated from everyone who is coming to hospital, so that there's no risk of increasing the infection within the hospital setting. We are going to also increase our protective gear to our staff to reduce the numbers of people who will be exposed to the infection amongst the health workers.
Minister, as you've mentioned, sooner or later some kind of normality has to begin to take effect again. Is there a way of avoiding that September peak? So once the lockdown is is lifted with whatever restrictions may remain in place, is there a way for the country to avoid getting to those 70,000 infections that have been projected?
Well, I don't think we must focus too much on the numbers, the days that are forecast, because it's about trying to manage a situation that has not arisen. So the numbers-wise are not real. They are actually an indication as to where we should look for weaknesses in our system. And what we are really saying is that we hope that the curve will be pushed in such a way that we must be able to get through winter months without experiencing too much pressure. But we cannot say that we did the lockdown for all of that time. There's going to be lots of work done to look at the way in which we're going to manage the rest of the coming months. But what is important is for people to know that the message on lockdown has really been a very important message, that people must stay at home until the end of the lockdown, that they must wash their hands, that they must make sure they disinfect their hands to reduce the spread of infection through their hands, that they should also use masks. In this case, we have actually said it's actually possible to use cloth masks, which we can make them themselves, which is an important issue so that the issue is sustainable. In addition, we have also said those specialized masks will keep them for health workers so that they are able to deal with the infection at the hospital level. So all of these issues for us are important. It's also important to say we need to buy time so that technology should continue to advance. We might have more solutions as months come along, so we want to use that space. For example, we want to see what's happening with the therapeutic trials that are happening. Are we getting drugs that are going to be strong enough to help us as we move on to fight this disease, which other countries may not have had an opportunity for, but looking at all of that. The issue also that would be important, which is we know it's not going to happen now, is the issue of the vaccine, which will probably be coming up maybe after 2 years from now. So all of these issues and new diagnostic tests, we're going to be working on the epidemic and trying to improve our situation as time goes along. So we need to push the epidemic, the pandemic to move further and further. The curve must not rise immediately. Fewer people must be infected so that we don't have our situation where our hospitals are failing to cope. At the end of the day, many of us will have the infection because naturally the virus that occurs in nature will ultimately involve many more people. But we are saying, because this one is new and it's got the possibility of causing serious harm, particularly when there are comorbidities, we want to try and drag it out as much as possible so that it doesn't overwhelm us.
Minister, ventilators seem to be part of the priority list that U.S. government are working on currently. The bulk of them lie with the private sector. Speak to us about the kind of collaboration between the private and public sector that you're expecting to see over the next couple of months while you're waiting for this additional capacity to come on board.
At the moment, although we've got about 2,173 people who are positive, the bulk of those people are not necessarily in hospital. So we haven't used anything close to 200 beds yet, which means that we still got lots of capacity both in the public and in the private sector, to absorb many more people. We are also creating additional beds which we will put outside the current hospitals so that we can channel people when the numbers increase, channel them out to specific hospitals where there will be specific treatment, where there is isolation, and so on. With that, we are then saying that between public and private health, we're going to be collaborating to make sure that all the beds that are available to the fight against COVID-19. There's a good understanding at that level. There's also going to be need for us to work together on ICUs, in intensive care units, ventilators. We're going to share that across based on the need. Some of the patients right now have been admitted in the public or in the private hospitals because they have been treated there. But we will also get to a point where when we think for intensive care beds, we need more, and a lot of in the public sector. We'll actually make use of those in the private sector. That agreement is on the table. We are happy with it. We're going to continue to work together. So we are actually saying to everyone, whether it's private laboratories or public laboratories, it's the same. It's just laboratories for us. Whether it's public hospitals or private hospitals, whether it's private general practitioners, we all are treating one outbreak, and we are collaborating right across, sharing information, sharing resources, and making it possible for each one of us to cope so that there is no side that is so weak, lest the entire health sector down.
Minister, we're expecting a flight to land with 200 South Africans in it as part of a repatriation process. Speak to us about what is going to happen once they arrive in South Africa.
Well, the issue of repatriation requires us to manage it fairly carefully. Firstly, those who are leaving the country, we put one condition, and the condition is we will not put into the aircraft anyone who's got symptoms suggestive of the coronavirus infection. And so we screen them up and make sure that they don't have symptoms, they don't have temperature, and then though we don't test them for COVID-19, we let them, because we are assuming that if they've got less symptoms, they may not be as infectious as it were. However, our team, our crew, is actually giving the kind of protective care that they limit any form of infection to them. They will go to those countries. They are also sealed up in the coverall gowns so that they don't expose to infection in the foreign country until they come back. So we are happy with that side. What we need to deal with are those South Africans who are returning, because it means now those who are returning might be having a potential of being infected, and therefore we need to discuss the question of quarantine. Anyone who comes back needs to be quarantined 14 days until we are sure that they test negative after 14 days. And those who are part of the crew, those are the ones we must discuss with, because if they're exposed to people who might be positive on their way back, it means also that we need to take care of them, making sure that they also have some degree of quarantine to deal with the fact that they could have been exposed. So those are issues that we are busy discussing with the relevant departments.
All right. Minister Zweli Mkhize here, of course, is the Minister of Health. Thank you so much for your time. We'll leave it there for tonight.